Our challenge all along is coming up with something that HHS would approve and we could get approved in the Tennessee State Legislature, which we knew wouldn't be easy. The plan we've come up with, we think, does that. First of all, it won't cost the state's taxpayers any additional dollars or be any hit to the general fund at all. It'll provide two different alternatives. One will be what we're calling the volunteer plan. It will allow those people who are currently, I guess the best definition is the working poor. They're folks who make it the poverty level, 138% of the poverty level or below, which is $16,000 a year or about $8 an hour, and are working now. We think that's about over half of the people that we think will qualify for this are currently employed. They just can't afford their employer's health insurance. So we would provide a voucher that would let them buy into their employer's health insurance plan. We like this for several reasons. We think that will help control costs in the sense the way that I think a lot of businesses or employers' health insurance plan has done in terms of having the right incentives in place for the user. Number two, it's our hope that people who are in any of the safety net programs, whether it be Medicaid, SNAP, or TANF on the food side, that those are safety net temporary benefits and they're moving back into a system where they don't need it. Hopefully these folks who are employed, like I said, at a lesser amount per hour than they can afford health care with, will eventually earn enough to where they can earn out of that but still stay in their same plan. Obviously also with employer-sponsored plans, those are welcome at a lot more with a lot more physicians than Medicaid is, a lot more places than Medicaid plans are, so we think it gives additional alternatives. So that's what we're calling the volunteer plan. The second plan is the healthy incentives plan, which will work a lot more like Medicaid, but with a couple of real distinctions. Number one, the plan will have premiums and copays. But the first question somebody might ask was, well, if you have premiums and copays and these folks are making, that amount of money per year, what if they can't afford that? What do you do? Well, the system will have in place the ability to earn credits. Think about the image of loading a debit card with credit. If you do make certain healthy choices. So if you decide to get preventative screenings, if you get an annual flu shot, if you go 6 months without using the emergency room for non-emergency care, just things that everybody would agree that's a smart choice that everybody can make if they just will make it. So the idea is that we would put those incentives in place to where smarter choices would make. One of the things that's taken us so long to come up with a plan that works is this. Medicaid is by its definition a free program that you can't deny care for any reason from a provider. So, and people think I'm sarcastic when I'm saying this, but I'm really not. So the challenge has been, how do you provide a system that has incentives for healthy behavior where it's free and you can't deny care? I mean, it's just the nature of that. It's difficult to figure out. So we think this actually can do that and begins the process, like I've said, of aligning incentives in the right way.